I'm Brian Carter. I'm a neonatologist and ethicist here at Children's Mercy Hospital and Clinics, and also teach here in the Bioethics Center, teaching the online Pediatric Bioethics Certificate course. Students for this program could come from any number of backgrounds within the healthcare professions. Certainly physicians, both those in training, such as residents or fellows, and those in clinical practice or academia. Social workers, chaplains, nurses, advanced practice nurses, and others might find this training beneficial. Research investigators and those that serve on IRBs might also find it beneficial as we entertain issues in ethics that are particular to the pediatric population. E-learning is a very participatory process. A number of materials are made available online, and there are actual discussion groups. There are questions posited each week based on the topic for the week. There are reflections upon course readings, and a great interaction between students as ideas are bounced back and forth, with occasional inserts from faculty to steer or direct or probe the discourse. Live conversation can certainly take place throughout the course. There are actual webinars in which live video feeds are made accessible to students, and those are then capable of emailing in questions and having responses, as well as telephoning in questions and having responses. Throughout the certificate course, we cover fundamental topics unique to pediatrics, including the best interest standard, the avoidance of harms, looking at basic ethics, precepts, principles, and positions in discerning right action on behalf of children, both by children who have the capacity to make such decisions, as well as by their parents. We look into legal ramifications, we look at end of life and beginning of life issues, research ethics, adolescent medicine concerns, and much, much more. We have taken students from outside of the United States, and they have absolutely enriched our course. This past year we've had students from Canada as well as Norway. We would look forward to international students from any continent on the globe. I think directly at Children's Mercy we benefit from this program by virtue of the expertise that's here within the center and the great interaction within the hospital staff itself. Children's Mercy is a freestanding children's hospital that is replete with subspecialists, and the culture here is really one that avails itself to ethical deliberation and doing what's best for children and their families. What I enjoy most about this course is the interaction that's prompted through the electronic online discussion, which sometimes then carries forward into email discussions, other correspondence, and meeting students at the beginning of the course and at the conclusion 9 months later of the course. Seeing them learn, become productive, and be able to go forward in their career path, whatever discipline they're from, is truly a joy.